you subscribe and hit the bell icon for more videos. Welcome back. Myself Mr. NK. You are watching your channel Nursing Medicos. Today we'll discuss NCLEX-RN AIIMS MOH nursing exam questions with rational. This is part 3. Part 1 and 2 already we discussed. I will give you link below the video so you can see there. So we'll start now. The first question is, arresting tremor is most likely related to what disease? So we'll see the answer. Answer is Parkinson disease. The tremor of Parkinson disease are generally asymmetrical and have the characteristics pill rolling appearance. First we'll see the Parkinson disease. What is the Parkinson disease? Parkinson disease affect the nerve cells in the brain that produce dopamine. Parkinson disease symptoms include muscle rigidity, tremors, and change in the speech. That is Parkinson disease. So, Parkinson disease are generally asymmetrical and have the characteristics of pill rolling appearance. We can see what is the pill rolling. That is the index finger of the hand that contacts with the thumb. We can see this picture. In that, index and thumb is contact each other. That is called pill rolling appearance. The next one. What is the most common side effect of beta blockers? We'll see. The side effect of beta blockers is fatigue, which occur early in the treatment, and depression, which occur later. In case of side effect of beta blocker, fatigue that occur in early and depression that will occur late symptoms. Next one. What is the most common presentation of cystic fibrosis in newborn? First we'll see cystic fibrosis. Cystic fibrosis is an inherited disorder that causes severe damage to the lungs, digestive systems, and other organs in the body. We'll see the answer. GI obstruction, which is due to meconium ileus. We'll see the meaning of meconium ileus. Meconium ileus is the bowel obstruction that occurs when the meconium in the child intestine is even thicker and sticky. The meconium is that block the part of the small intestine called ileus. So GI obstruction, which is due to meconium ileus. Next one. Fourth one is, are aspirated foreign body more likely to be found in the right or left bronchus? So we'll see the answer. The answer is the right. This is the because of the right bronchus is the straight and foreign body objects are more likely to follow this path. We can see this picture. In that right bronchus is slightly right than the left. So answer is the right. The next one. What are the classic signs and symptoms of TB? The answer is night sweating, fever, weight loss, patient lose the weight, cough, and there is a greenish yellow sputum, most commonly seen in morning time. That is the classical sign and symptoms of TB. The next one. What vaccines should be given to adults? We'll see one by one. The first one is hepatitis B vaccine for patients at high risk, healthcare workers, homosexuals, and drug users. The second vaccine, influenza vaccine, should be given earlier to elderly patient or patient with chronic illness. Third one, MR most often required schools institution. It should be given to all patients with immunity. Then fourth one, pneumococcal vaccine should be given once to patient or 65 to any patient with a chronic illness. Then fifth one, tetanus and diphtheria, a primary series, then booster every 10 years. We are giving all adults should receive these vaccines. The next one, what is the most common cause of bacterial diarrhea? You will see the answer. That is the E. coli. E. coli, that is the main cause. Entero-invasive, enteropathogenic, and enterotoxigenic. That is the E. coli is the main cause. The eighth one, what are the major cause of acute pancreatitis? We'll see the answer. That is alcohol consumption and biliary disease. That is the main cause. The next one, how does hyperglycemia lead to hyponatremia? We'll see in detail. Because glucose stays in the extracellular fluids, hyperglycemia draws water out of the cell into the extracellular fluid. Each 100 mg DL increase in plasma glucose decrease the serum sodium by 1.6 to 1.8 milliequilibrium per liter. That is the main cause. Next one, what are the signs and symptoms of hyponatremia? We'll see. There is the weakness, nausea, anorexia, patient feel vomiting, then confusion, lethargy, there may be seizures and coma. That is the main symptoms of hyponatremia. Next one, what are the ECG finding on a patient with hypokalemia? We'll see the answer. There is flat T waves, there is a depressed ST segments, prominent P waves, then prominent U waves, and prolonged QT and RR intervals. That is the in case of hypokalemia. The next one, the next 12th one is difference between Decerebrate and Decorticate posturing. We will see. Decerebrate, that means elbow and leg are extended, which is indicative of a midbrain lesion. Then decorticate, elbow are flexed, legs are extended. This suggested a lesion in the thalamic region. So in case of Decerebrate, the lesion is in the midbrain, and in case of Decorticate, the thalamic part is affected. The next one, difference between partial and generalized seizures. We'll see. Partial seizures arise from a single focus and may spread out, whereas generalized seizure involve the whole cerebral cortex. Absence and grand mal seizure are example of generalized seizure. Generalized and complex partial seizure involve a loss of consciousness. The next one, which hypertensive medication should not be given to diabetic patient? The answer is diuretic and beta blockers we should not give to diabetic patient, because these drugs increase insulin resistance. AC inhibitor are the drug of choice for those patients in case of diabetes. The next one, what is the sundown syndrome in elderly? We'll see. That is the hallucination and delusion that occur at the night time. That is the sundown syndrome. What is the hallucination? Hallucination is the false perception, and delusion is the false beliefs. So Thanks for watching. You subscribe, like and share my YouTube channel. Thank you.